We will move on to the second portion now. I will hand it over to our WVPBRN leadership. I'll start off with handing it over to our Network Co-Director Jen Boyd, and then Stacy Wanger will be weighing in on our discussion of provider burnout here in West Virginia.
Thanks, Jen. Thanks, everybody. That was fun to get that didactic on posters and then that conversation. So people who are part of the PBRN steering committee will recall that we had a conversation a couple of weeks ago at our meeting about our upcoming retreat in May. We hope to have in person. And we are planning on having a session that features conversation about provider burnout. And as we were talking about this at our steering committee meeting, we thought that it would be a really interesting idea to have attendees actually take a burnout assessment survey. And there are a lot of options out there. We discussed that a little bit. And, you know, the obviously the MASLAC burnout inventory is the probably the gold standard, but there are other options that we've talked about. And so then we had a conversation about turning that into a study where, because we would have a, you know, this population of people attending the retreat who, by nature of the fact that they're in the PBRN membership, have involvement outside of their clinical capacity. They have involvement in another organization, in this case, the PBRN, and going with the hypothesis that involvement in an outside organization in general, or specifically in a PBRN, decreases burnout. We thought that by administering the survey, looking at the results, would be an interesting opportunity to test that hypothesis. So we wanted to bring that idea to Design Studio for conversation and feedback. And I know that we have a couple of questions right off the bat, and Stacy and Bill will chime in here in a minute, I'm sure. One question is thinking about that there will be a variety of professionals attending the retreat. Some will be primary care clinicians, some will be academic-based researchers, some will be administrators. And so that in and of itself, I think, creates an opportunity for some interesting comparisons of burnout rates. The other thing is, if we wanted to compare burnout rates specifically of physicians, of providers attending, clinicians attending the retreat, would we then, we're curious, would we compare, and Bill and Stacy may have ideas about this, but would we be comparing that to a national, survey of burnout amongst clinicians, or there is a fairly recent study of West Virginia clinicians and burnout. So we wanted to throw the idea out there and get overall feedback, and then feedback on those specific questions. Stacy, got anything to add to that intro?
The only other thing I would just want to add is, as we were thinking through some of the different comparators, you know, kind of the overarching cloud is COVID and how that has added another layer. So what we knew even before may not be the same information as it is now. So really, we just wanted to see what are others' thoughts on that? What would be a good way to evaluate that from a PBRN's perspective? And you know, what do we need to make sure that we have in place to make that a really good, solid project?
So Jen, I've got a question and idea that may help you with this. So one of my theories in some of the burnout is that people that are involved in different activities, such as PBRN, or, you know, have other roles that aren't just, you know, 100% clinical, may have less burnout, I suspect. And so kind of looking at and again, people's percentage time doing clinical work versus administrative work versus research, and using and comparing that to other clinicians. So my hypothesis would be that the people involved at the PBRN are going to be less burned out because they have other outlets. And so that would be one of the questions you may want to include is, what percentage or what other things are you doing? I find that in a lot of our family medicine docs are looking to do other things because they realize that 10 clinic sessions a week is no longer manageable. 9's not manageable. And so I think people that are able to do that do better. I haven't seen any studies on that. They really, looking at people in academics, or, with other roles, whether it's administrative, things like that. It's real easy when, if you're dean or associate deans or vice presidents do half a clinic session a week, well, they don't really have the same level of, maybe different kind of burnout, but it's not the clinical. So I don't know if that may help you or not, or if anybody knows of any, data on that.
I think that's a really interesting suggestion to include percentages, because we'll have people there who are involved in the PBRN, but they may be involved in other things and as well. But that is our thinking, is exactly what you said, that it can help mitigate burnout to be involved in other activities. So thanks, that was a great suggestion.
Yeah, this is one of those areas that we're looking at. One, reduce burnout for the providers, but two, also a selling point of, hey, if you work with a research group, you can find a fulfilling outlet. So it's as much to justify the existence of PBRNs, and if it helps and reach out. Obviously, this is not going to be large enough to draw huge conclusions, but we'll get some preliminary data. I kind of figured we could just use whatever scale we're using, use the national standard. Hopefully there's a current one that accounts for COVID and on one of these tests, and then take that and compare where ours are to what real time or close to real time as we can get. So, because I've heard from some, oh, sorry, go ahead, Mary.
Go ahead.
I was going to say, we've heard from some clinic administrators, part of the reason they want to participate in the PBRN as FQHCs is because they feel like it can help their physicians and it will engage their physicians further. So if we can find any way of actually capturing that it really does, it is beneficial for their providers in some tangible way, I want to show that and be able to spread that out. So, sorry.
That's okay. I just want to say that or share that even as I don't take care of patients, I might see some patients because of a consult once in a while. But the one thing that has stressed me more than anything has been just the shortage of staff. And as a manager, having to deal with staffing issues and the volume of work that continuously gets carried on, has to be carried on. And so looking at how staffing affects people's response to the stress or or how that might affect the level of burnout or the level of stress in people's lives.
Right, and that seems like a real COVID related thing to me. There's decreased staffing, and there's also increased volume of work related to COVID.
Now, does anybody have thoughts on, because we discussed in general, but from the leadership, are there any burnout surveys anyone's seen that has a national standard to compare them back to? We're kind of in the research phase of which one we want to do, but if anybody's got any feedback on that or has used any, yeah, I just don't know if there's a comparison within these or it's a comparison within the group.
So I would say that's probably the biggest question to me. Because in my mind, I guess I was thinking that the better comparating group, just with all the other factors, would be within the group itself. But we're thinking about this from the retreat standpoint, and logistically, does that make sense? Or should we really look at that national comparison? That to me saves time, right? So then we don't have to re-engage some of those folks after the retreat or in any other way. But yeah, I don't know of what are the best tools to do that. So I think that's the biggest question in my mind. I'm just not sure how to best compare what we find.
The other option, maybe if you really want to, because Bill's right, it's going to be small numbers. But do you want to target more of a qualitative approach? Like coming to the retreat helps me burn out less. Or I know that through one of our projects here, they're doing a narrative group on some stuff, kind of for burnout and physician, kind of places where they can share stuff. So it may be better as a qualitative if you're looking at a small thing and really kind of, the question is, does PBRN cost me more stress or less stress, really? And what are people's stories? And hopefully they're coming in there, and you may get some of those points that I was trying to get at, which is by having different jobs, it brings me, and so qualitative may be a better way of doing it, and doing kind of a workshop and having people write that down and then having it analyzed by some of our qualitative social scientists might be a better way, because it's going to be fairly small otherwise, I think.
Especially if you shake it out in different, considering the different professions that will be there.
Right.
That's a really interesting idea.
And then you can take that and do, a statewide survey, for example, with those perspectives, maybe that would follow up on it.
Here's three that were used in one study that I have. It's impact of events scale. And of course, the PHQ-9 is always there. And then there's another one called the Generalized Anxiety Disorder Scale. And that's only got 7 questions. The first and the last one came from a clinical psychologist.
That's great, Mary. Thank you.
You're welcome.
I got it pulled up right now. So part of how we were hoping to do this for the retreat is we were talking about burnout to inform researchers more of the state of primary care and what we're experiencing to help phrase the research questions and the impact and how to act and how the ongoing stress of primary care affects research projects. So we proposed just doing the scale for the group as a reference, so we're getting it out there and people can kind of understand and see in real time what it is, have everybody run through one of the scales for themselves so they have some feeling and understanding for that. And then we started brainstorming that this data we may be able to compile it and again show that if you're engaged in other activities, it really is beneficial for you. That was kind of our guiding idea from when we wanted to get it out there. But
So as I'm hearing people talk, and I'm not familiar with the literature on that, but I wonder if there's an opportunity, without overburdening people, maybe we could use the shorter versions of the GAD-7 and the PHQ, 2 and 9 that Mary was talking about. But to get a better understanding of, how much of burnout, if you will, statistically is related to anxiety, how much of it is related to kind of those measures of depression, and then what of it is unique, unexplained variance within burnout that's not accounted for by those other 2 factors. It's an interesting question. I'm not sure if it's a question we want to try to tackle right now, but we could take a look at the literature and see if there's anything out there on it currently.
Yeah, and that's, I've always had the feeling on the individual person, it is depression and anxiety, and the burnout is really the institutional problem of what is it about our institution that puts people in this place that they're getting depressed and anxious from the job and the work, and how is that contributing to it. And again, on the individual, it's still the same base ones, but it's just the job, and it's there's a lot of talk about the moral insult that comes on that you can't do your job the way you want to, and that's what builds up and causes some of this. But yeah, you're right. And so reading through the impact event here, it really looks like it's a really extensive depression screening for the individual here in particular. So it looks like a really good one. But
Excellent. Well, if there are any other suggested, anything that we find through a literature search, or if there's some sort of tool that we could consider, or if you kind of start discussing with colleagues of yours and you want to help connect us with them, and we can continue this discussion to really see what the best approach would be, just to send them our way. And we hope to continue to explore this a little further in preparation. Our event's not until May, so we still have a little bit of time there.
Thanks for the conversation, everybody.
yeah, thank you.
Absolutely. Does anyone else have any further questions or feedback circling back to anything from this session today so far, or something to propose to the group for the future? Okay, I'll take that as a no for right now. As a reminder, we'll be sending out a streamlined recap of our discussion. We'll include some of the materials, such as the slides provided by Dr. Shepard, and then a edited recording of our time together here today. So I'll go ahead and we'll release class a little bit early today on this Friday. And please feel free to reach out to either me or any member of our team directly to continue the conversation or any follow-up questions that you may have. Thank you so much for your time.